We, Cassandra, Leslie, and myself, are excited to present our project Mindful Miles. This project focuses on promoting mental health among SHU undergraduate commuter students. You know that mental health challenges are often overlooked among the computer students. Our project management and campaign initiative is designed to change this belief. By combining the integrated model and the extended parallel process model, our campaign promotes mental well being through interactive workshops, engaging tabling events, and dynamic social media outreach. These efforts aim to connect the commuter students with preventive strategies and essential on campus resources to create a supportive and proactive environment that prioritize the commuter students' mental health. Our project stakeholders include parents of undergraduate students, faculty, the counseling center, administration, commuter students representative, and peer leaders or mentors. The purpose of our project is to highlight the importance of mental health among commuter students because poor mental health can lead to serious consequences like decreased academic performance, higher dropout rates, social isolation, and even physical health issues. On the other hand, fostering good mental health results in improved academic performance, higher graduation rates, stronger social connections, and greater resilience. By addressing these issues, we aim to empower commuter students to thrive both academically and personally. The highlighted strategies for this campaign include the Sweet Peer Educators Program, resilience and stress management training, digital tools and resources, and promoting existing mental health services. These approaches are cost effective as well as designed to maximize impact. By utilizing existing resources and complementing them with digital tools and stress management training, we can enhance SHU's mental health support system and better address the needs of the commuter students. Commuter students face unique challenges, and that's what makes this audience segmentation crucial for mental health initiatives for them. Balancing academics, commuting, and part time jobs combined with limited campus engagements often leads to isolation and heightened stress. Tailoring mental health efforts to this group is essential to address their specific needs and promote positive attitudes, raise awareness, reduce stigma, and encourage service utilization. Enabling them with stress management, mindfulness, and time management skills can make a significant difference in supporting their overall well being. Our campaign uses a theoretical framework combining the integrated model and the extended parallel process model. The integrated model draws from the theory of planned behavior and the theory of recent action to shape intentions to seek mental health support by addressing behavioral, normative, and control beliefs as well as perceived access to resources. The extended parallel process model focuses on threat appraisal, highlighting the risk of unaddressed stress such as academic burnout, and efficacy appraisal, emphasizing the ability to manage stress with available resources. Together, integrated model and extended parallel process model foster positive beliefs, build confidence, and encourage active use of mental health resources.
For our campaign objectives, for our informational objective, we said that for our learning objective, by the end of the semester, 90% of SHU students will be able to identify 3 preventative mental health activities, including journaling, mindfulness, and meditation. For our behavioral objectives, for our learning objective, we said that after attending mental health workshops, 80% of students will express confidence in practicing at least one preventative strategy for stress management. For our action objective, for our behavioral objective, we said by the end of the campaign, 70% of students will report engaging in at least one self-care activity weekly, such as journaling, mindfulness, or meditation. And for our outcome objective, for our action objective, we said that by the end of the semester, 60% of students will have used a digital or physical mental health tool, such as a journaling or mindfulness app, at least once. For our environmental objective, we said by the end of the semester, we would establish accessible mental health resource stations in at least 3 key commuter areas on campus, such as parking lots, lounges, and shuttle stops, which would be equipped with different informational materials, self-care guides, and QR codes, which would be linking to mental health tools and services. So for the pros, cons, and possibility of our communication resources, some of the resources we would use are the SHU website, social media, newsletters, organizations. And some of the pros of these resources is it's reliable, it has centralized information, it's very visible on campus, and it's speaking directly to the target audience. And some cons is that there could be the possibility of limited engagement if it's not regularly updated, limited space, and it could be easily overlooked because there's a lot of things going on campus, especially with the email newsletters. It could be easily overlooked. For the possibilities for our communication resources, we said that we could be using engaging brief content and have regular updates for engagement with engaging subject lines that would catch people's attention. Our partner plan would involve collaborating with other SHU organizations, which would appeal to different subgroups under the commuter category. For example, the Office of Inclusive Excellence would target the needs of underrepresented students, and they can be recruited through email and phone. And this would involve meeting with the leadership of the different partners to develop a program that would meet the needs of both our campaign and their organization. And the potential benefits of this is we would meet our shared goals, foster new relationships, share our resources, and gain a new perspective. So for our channels and vehicles, our message map indicates that we have 3 main messages. So our first message is that daily self-practices help manage stress and improve mental health. And this can be done through journaling, which would help to reduce anxiety, mindfulness, which would reduce stress and improve focus, and meditation, which would improve emotional well-being. For our second message, we said that counseling visits are not the only way to take care of your mental health, because self-care practices can be done independently by utilizing tools such as mindfulness apps, and can be done anytime and basically anywhere, including in between classes. And for our third message, we said that preventative actions will help students maintain mental health even after SHU. Many graduates won't have access to formal counseling services after SHU, so it's important to maintain those mental health habits and build this resilience for future stressors. Mental health muscles can be strengthened with daily self-care. So our pre-testing was conducted via 2 interviews with 5 commuter undergraduate students. It was an 8-question survey. Qualitative analysis was done where 26 codes were generated and 3 codes were prevalent. So the 3 codes that were prevalent were action and mental health. People said it encourages them to practice more healthy coping styles on how to actually manage their mental health care. Acceptance and resonate was another one. They said that they think this deliverable was culturally and socially acceptable, and they felt that if they saw the flyer, they would be engaged with it. And relevance and relatability was the last code, and they thought that the resources were relevant and accessible for computers. And it's good to mention that the resources we mentioned offered online services as well, and that means that the accessibility is going to be met for commuter students at SHU.
For our campaign sequencing, our channels include print and digital posters, support products, and social media. Printed posters will be placed in areas on campus that are frequented by commuter students, including building entrances, parking garage elevators, and shuttle waiting areas. Digital posters will be uploaded to social media platforms like Instagram and TikTok to broaden their reach where students are already engaged. Support products will be distributing at tabling and giveaway events, as well as mental health colloquies about mental health, serving both as practical items and tangible reminders of our campaign messages. In addition to digital posters, video contests and student submissions will be uploaded to social media platforms to further engage with commuter students. The campaign will maintain momentum throughout the semester. In August, we'll kick off with flyers and social media posts to introduce our campaign and its key messages. As the semester progresses, we'll align activities with events such as Mental Health Awareness Week and International Stress Awareness Day. This includes giveaways, video contests, and themed content leading up to finals. This sequenced approach ensures our messages are timely and relevant. Our campaign's inputs include personnel, supplies, and in-kind contributions. It would be supported by 3 graduate and PhD students, Shoes Counseling Center, and Sweet Peer educators. Supplies include affordable yet impactful items like tote bags and other promotional materials. This brings our total proposed budget to $1,184. Our planned outputs include creating and distributing awareness materials across SHU, adapting these messages for social media platforms, and training the Sweet Peer educators. These educators will connect commuter students to resources and encourage engagement with mental health tools. These activities are designed to reduce stigma, promote healthy coping mechanisms, and ultimately increase the visibility of mental health support on campus. For our short-term goals, we're seeking to increase awareness of available mental health resources, mindfulness practices, and mobile applications. Our intermediate goals include reducing stress and anxiety among commuter students by fostering engagement with mental health support resources. In the long term, our goal is to build a culture of resilience and mental health awareness that persists beyond SHU. Flyers will be prominently displayed in areas like building entrances, parking garage elevators, and shuttle waiting areas. They will be written in plain language for broad accessibility. Social media content will include contests and engaging visuals to promote our messages. Support products such as chargers and magnets will further our reach, serving as daily reminders of the campaign and its messages. To evaluate the implementation of our campaign, we'll use the following data sources to track progress. Social media engagement will be measured by analyzing likes, shares, and comments on Instagram and TikTok posts. For tabling events and giveaways, we'll track the quantity of distributed materials and gather feedback from participants. Attendance at mental health workshops will be documented through sign-in sheets. Flyer performance will be evaluated using QR code analytics, providing insights into how many students accessed link resources. We will measure the campaign's success in achieving its key objectives by using pre- and post-campaign surveys with undergraduate commuter students to collect data. Our impact evaluation will be conducted using 6 questions about knowledge of preventative strategies, usage of wellness center resources, confidence practicing preventative strategies, engagement in self-care practices such as journaling or meditation, usage of mental health tools, both digital and physical, and accessing mental health resources from the newly established stations. This data will be collected before and after the campaign ends, helping us understand its effect on commuter student mental health habits and awareness.